Paresthesia, a word that might sound complicated, describes a very common sensation. That feeling of pins and needles you get when your leg falls asleep. It's a tingling, prickling, or numbness that can happen anywhere in your body. Most of the time, it's temporary and harmless, fading away quickly. Imagine sitting on your foot for a while. You stand up, and your foot feels all tingly. That's paresthesia. It's your body's way of saying that nerve signals are a bit mixed up, often due to pressure on the nerves. But paresthesia can sometimes be a sign of an underlying medical condition, especially if it's persistent or recurring. That's why it's important to understand what causes it and when it's time to see a doctor. One of the most common causes of paresthesia is nerve compression or damage. This can happen when you sit or stand in the same position for too long, compressing nerves in your limbs. Certain medical conditions, like carpal tunnel syndrome, affecting the wrist, or sciatica, affecting the lower back and legs, can also cause nerve compression and paresthesia. Another culprit is poor blood circulation. Just like a hose with a kink in it, restricted blood flow can prevent nerves from getting the oxygen and nutrients they need to function properly, leading to those familiar tingling sensations. Conditions like diabetes, peripheral artery disease, PAD, and even exposure to cold temperatures can impact circulation and contribute to paresthesia. Stress, believe it or not, can also play a role. When we're stressed, our bodies go into fight or flight mode, diverting blood flow to essential organs and potentially reducing circulation to our extremities. This can lead to temporary paresthesia, often in the hands and feet. Paresthesia isn't just about tingling. People describe it in many ways: pins and needles, prickling, burning, itching, or even a feeling of crawling under the skin. Sometimes it can feel like a dull ache, or a feeling that something is touching your skin when it isn't. Imagine wearing a wool sweater that's constantly prickling your skin, or the feeling of tiny insects crawling on your arm. These are some of the ways people describe paresthesia. The intensity can also vary, from a mild annoyance to a distracting discomfort. The location of paresthesia can offer clues about its cause. For instance, tingling and numbness in the hands and feet could indicate carpal tunnel syndrome or diabetic neuropathy, while paresthesia in the face might be linked to a migraine or dental problems. Section 4. Navigating relief. Treatments and lifestyle adjustments. Treating paresthesia effectively involves addressing the underlying cause. If nerve compression is the culprit, simple lifestyle changes like taking frequent breaks from repetitive motions, practicing good posture, and ergonomic adjustments to your workspace can make a world of difference. For paresthesia related to poor circulation, regular exercise, maintaining a healthy weight, and avoiding smoking can improve blood flow and reduce symptoms. Managing stress through techniques like deep breathing exercises, yoga, or meditation can also be beneficial. In some cases, your doctor might recommend over-the-counter pain relievers, anti-inflammatory medications, or in more severe cases, prescription medications to manage nerve pain. Physical therapy can also be helpful in strengthening muscles and improving mobility, particularly for paresthesia related to nerve compression. Section 5. Seeking expert guidance. When to consult your doctor. While occasional paresthesia is usually nothing to worry about, it's important to seek medical attention if you experience persistent, recurring, or worsening symptoms. This is especially true if the paresthesia is accompanied by other symptoms, like weakness, pain, loss of coordination, or bowel or bladder problems. Don't hesitate to reach out to your doctor if you have concerns. They can help determine the underlying cause of your paresthesia and recommend the most appropriate course of action to manage your symptoms and improve your overall health and well-being.